Hi, my name is Sarah Peterson, and my partner Daniel put together a presentation about workplace bullying and harassment. A little bit of background about me. I have been an oncology nurse and worked in oncology my entire career. I was a chemotherapy nurse first, right out of school, and then transitioned into cancer research in about 2013. I've worked as a research coordinator for almost 7 years, and I'm a mentor for our system oncology research team and a preceptor for all new employees. I'm a member of our breast leadership committee for Aurora Baycare Medical Center, and I participate in our SOP committee for research. I passed the oncology certified exam in 2010, and I continually keep up with this education. In 2017, I passed the Certified Clinical Research Professional exam and also maintain this certification. The objectives of our presentation today is to define workplace bullying, help understand what workplace bullying is, discuss how bullying affects workplace environment, and explore how nurse leaders can handle bullying. We will also be examining a research study that was done on organizational bullying and present you those results. The definition of bullying is closely related to lateral violence, but a real or perceived power differential between the instigator and recipient must be present in bullying. Bullying is associated with psychological and physical stress, underperformance, professional disengagement, increased job turnover, and diminished quality of care. Bullying, which the American Nurses Association, the ANA, defines, is repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. An extremely serious issue that threatens patient safety, nurse safety and sanity, and the reputation of the nursing profession as a whole. Any nursing student has heard the phrase, "nurses eat their young," which was first used by nursing professor Judith Meisner in 1986. The expression has become standard among nurses, and the meaning behind it is quite simple. Simply, it refers to the bullying and harassment of new nurses, and those 4 simple words can cause a great deal of anxiety for new graduates. In fact, researchers propose that at least 85% of nurses have been bullied at some point in their nursing career. My next slide is understanding workplace bullying. It's essential to understand by nurse leaders, managers, and human resources. The most frequent source of verbal abuse towards other nurses, and over half of nursing students report being put down by staff members. Quality of care is compromised, and the Joint Commission acknowledges unresolved conflict and disruptive behavior adversely affects safety and quality of care. The Joint Commission mandates that organizations have a code of conduct that defines acceptable, disruptive, and inappropriate behaviors, and that leaders create and implement a process for managing these conflictual situations. One-on-one conflict resolution must be encouraged, but a mechanism for confidential reporting is also necessary. Horizontal violence or bullying is experienced by not only student nurses, but also the novice and veteran nurses. Research has shown infighting and general lack of support in nursing for each other to be a common occurrence. New graduates are likely to experience this horizontal violence, resulting in high absenteeism and thoughts of leaving after their first year of nursing. The main concern, regardless of why bullying or lateral violence occurs, is patient safety. Impaired interpersonal relationships between nurses at work can cause errors, accidents, and poor work performance. Disruptive behaviors are toxic to the nursing profession and have a negative impact on retention of quality staff. Recognizing the tendency toward bullying, harassment, or intimidation in the workplace is a prerequisite to preventing it. Horizontal violence is often underreported for any number of reasons, and organizational leaders often are not aware of its existence. Next is significance to the work environment. This causes negative outcomes for nurses, other healthcare professionals, and patients. Bullying is toxic to the profession and has a negative impact on staff retention. It's detrimental on patient outcomes. It increases stress and reduces productivity. Bullying causes a loss of trust in an organization and management team, and it's a significant cost to the healthcare industry. How nurse leaders can handle bullying. First of all is setting the stage for addressing the problem, fostering an environment of open, honest communication and collaboration. Nurse leaders can create an environment that bullying is not tolerated, develop organizational culture that promotes zero tolerance policy, encouragement to report all violence or bullying, create non-retaliation policies to increase reporting, educate all team members of professional code of conduct. I interviewed my preceptor and mentor, Sarah Pearson, a master's degree nurse, and she's a manager of the patient care intensive care unit at Aurora Baycare Medical Center. The first question I asked her is, what is the impact on nurses and staff when bullying occurs? She responded, bullying by other staff has a huge impact on morale and safety. It prevents the bullied nurses or those who observe a bully from feeling safe to speak up without fear of repercussions. They also don't want to complain to their leader because they either think they can't handle it, will be labeled as weak or whiny, or don't believe anything will be done about it. The second question we talked about is, what is the impact on patient safety, quality of care, and quality of care? She says, anytime a nurse doesn't feel empowered to speak up, it can have either a direct or indirect impact on safe care. The third question we talked about is, what is your perspective about bullying and how does this impact decisions made by management and administration? She responded, stating, we are currently campaigning and encouraging our staff to speak up and report safety events. Anytime we feel there's bullying going on or hear of it going on, we attempt to investigate. Our team member behaviors have been updated to let the staff know what our values are, and our performance ratings and feedback is heavily weighted with these topics. The next question we talked about is, how does this impact economics? She said, any decrease in quality or safety impacts the bottom line. Increased length of stay, staff injuries, patient hospital-acquired events, such as pressure ulcers, infections from devices, or surgeries, and she listed many more. She stresses that to reinforce resilience and positive supportive culture through our team member behaviors. Some good resources for this is on the front page of our Caregiver Connect under team member and leadership behaviors of the Communication Hub. She really likes the behavior spotlights. I asked her if she could share any policies and procedures on how our organization deals with bullying. And she did share several of our policies through Advocate Aurora Health. And there are several different ones that deal with bullying and harassment and lateral violence. And there's algorithms set in place for nurse leaders, administration, and human resources to follow when they need to deal with a situation of bullying or harassment. Sarah says, beyond encouraging positive culture change, we have a workplace violence committee, which also delves into lateral violence as well as patient-visitor violence. We partner with HR to make sure we are documenting any lateral violence situation appropriately and responding promptly. Next, we will examine the research study that we selected for this assignment. The title is called Workplace Bullying Among Nurses and Organizational Response, an online cross-sectional study. The authors are listed here. Catherine Brewer is a master's PhD student. Associate Professor Mi O, Professor Kisantas, and Professor Zayo published this article in November of 2019. It was published in the Journal of Nursing Management 2020 magazine, volume 28, pages 148 through 146. The research study did get IRB approval, and it was deemed exempt by the George Mason University IRB. The consent was waived. However, the survey had a one-page consent where the participants needed to select the response indicating their consent to take the survey. The purpose of the study was to explore bullying and associations of organizational support and betrayal with well-being among nurses exposed to bullying. The variables included bullying, organizational betrayal and support, and well-being, burnout, job satisfaction, and absenteeism. The findings contribute to the evidence base of nurses' well-being, which is an important issue for nurses and administrators. This is a cross-sectional study. A convenient sample was sought. The data collection method was anonymous online survey. The target population was registered nurses in the United States. The inclusion criteria was broad. Number 1, you had to be a registered nurse. Number 2, worked in a nursing job for at least the past 6 months. Demographics, including the workplace, was collected, but not used as exclusionary criteria. To discuss the sample, the size was 242 participants. They were predominantly female, white, non-Hispanic, greater than 50 years of age, greater than 20 years in nursing, worked full-time, identified as staff nurse, and worked in non-magnet facility. A slight majority, 130 participants, or 53%, worked in hospitals. Ambulatory nurses consisted of 9%, educational setting nurses 8%, long-term care facility setting 8%, community nurses 5%, outpatient procedure center 2%, and other settings was at 11%. The methods used for this research study were surveys. The surveys included negative acts questionnaire, revised for nursing, institutional betrayal questionnaire for health, a well-being index, job satisfaction scale, and demographics questions. The data collection was done via an online survey. Recruitment was done via advertisements. The survey ran for 7 days. It had 4,000 views and 150 clicks. Direct recruitment was done via social media, and this data was collected between December of 2018 and January of 2019. The data analysis is listed here. Frequencies and percentages were used to describe the sample and bullying. To determine prevalence, bullying was dichotomized as score of 10, which indicated weekly or daily bullying. Chi-square tests were utilized to examine associations between demographics, workplace characteristics, and bullying. Some variables were not fit to a normal distribution, so dichotomous scoring and non-parametric testing were used. Chi-square tests were conducted to examine bivariate associations between variables. Hierarchical logistic regression analysis was conducted for each of the outcome variables. An SPSS version 25.0 was used for data analysis, and the significance level for all analysis was set at 0.05. Let's look at the results. So the prevalence of bullying on the sample size of 242 using a cut score of 10 on an NAQR US questionnaire, The prevalence of bullying on a daily or weekly basis was 31%, or 75% of the respondents selected yes. To discuss organizational betrayal, support, and well-being, overall, 67%, or 125 participants, were at risk for burnout. 33%, or 58 nurses, were dissatisfied with their jobs. 50%, or 87 nurses, reported missing at least 3 days of work for illness or personal reasons. The significance with demographics and the workplace characteristics was between hours worked per week and absenteeism, a p-value of 0.04, and between magnet status facilities and job satisfaction was also a p-value of 0.04. Looking further at the results, logistic regression analysis looked at nurses who experienced greater or equal to 1 act of betrayal were more likely to experience burnout, a p-value of 0.02, dissatisfaction with their jobs, a p-value of 0.04, and to miss 3 or more days of work, a p-value of 0.001, than those who did not experience greater or equal to one act of betrayal. Nurses who experienced greater or 1 action of support were less likely to be dissatisfied with their jobs, a p-value of 0.001, and to miss 3 or more days of work, a p-value of 0.04, than those who did not. The Hosmer-Lamshaw test indicated the model adjusting for all covariates was not significantly different from the fit or an ideal model and was a good fit for the data. Classification results also indicated a strong model with overall correct classification rate of greater than 67% for all models. This study was one of the first noted that examined organizational betrayal in nursing. This was a significant predictor of poor well-being. Consistent with qualitative findings in other studies, nurses describe feeling let down by their organizational leaders. It is not surprising that nurses who experienced organizational betrayal were more likely to experience burnout. Betrayal contributes to the lack of joy in work and less effective commitment to their workplace. Organizational support was a significant predictor of job satisfaction and absenteeism. Nurses who feel supported in the context of bullying were more satisfied with their jobs and missed less work. This study had several limitations, and they are listed here. Causal relationships cannot be determined, and generalizability of the findings is limited. Using a convenient sample, the sample size was small in relationship to the target population. Nurses not on social media were potentially not recruited, and non-response could not be measured. And the sample lacked racial and ethnic diversity. Next, we will talk about the study conclusions. They are also listed on this slide. The conclusions explore organizational factors that impact nurses' well-being, specifically bullying and organizational responses to bullying. The study concludes measurement of betrayal and support after bullying is a relatively new contribution to nursing literature. This study concluded betrayal and support had significant associations with well-being, and it contributes to evidence-based that nursing work environments are important to nurses' well-beings. The implications for nursing management. Nurse leaders play an important role in orchestrating organizational communication and a culture of safety. Leaders need to confront the issue and prevent bullying in the workplace by creating prevention policies. Nurse leaders should be aware when responding to bullying about how organizational actions are perceived by nurses. Experiences can contribute to nurses' well-being, and well-being, especially burnout, is an important issue for the nursing profession as a whole. Nurse leaders should be aware that nurse bullying is associated with retention and patient care quality. Next, you will be hearing from my partner, Daniel, who prepared the second portion of this presentation. Thank you.